I cannot think how it would be for a family to know that there's treatment available to save your kid's life, and you cannot access to it.
That's Alejandra Mendez. She's a board member of a foundation in Chile that works to help families of kids with cancer. Today we're going to hear her story. That's next on St. Jude Around the World. I'm Suheir Rasul, and I have the privilege of serving as a Senior Vice President for ALSAC, the fundraising and awareness organization for St. Jude Children's Research Hospital. As part of the St. Jude Global Mission, we collaborate with nonprofit organizations worldwide to fight against pediatric cancer and other catastrophic diseases. This podcast brings you real stories of the life-saving work of our St. Jude Global Alliance partners. Many children and their families from around the world have come to St. Jude Children's Research Hospital for treatment and leave not only cured but also inspired. That's the case with a group of parents who came from Chile and once they returned to their country, decided to give back. They created a nonprofit organization called Fundación Nuestros Hijos, modeled after St. Jude. They understood that treatment alone wasn't enough, and it was just as critical to provide the psychosocial support for the parents and the entire family. And Alejandra Mendez, one of the founders, says that's where the foundation comes in.
Chile is a very long and narrow country, and we're centralized. So the big pediatric oncology hospitals are located in Santiago or in another city. So people need to relocate in order to receive treatment. So we provide home-away homes, so accommodation for those children and the family. We provide in-hospital schools for them to continue their education. We provide some medical services not covered by the state, for example, pain medication, and some other medications to treat secondary effects like, nausea, and these are not covered. So we provide that. Mental health is not covered by the state. And of course, adolescents or children need that. It's super important for their well-being. So we provide psychologists and mental health treatment for them and their caregivers as well. Survival rates are pretty good in Chile. So we have a number of survivors are growing, but unfortunately, 80% of our survivors present side effects, like could be cognitive or physical, right? So we provide a rehabilitation center for those kids. We not only cure them or try to cure them, but we want them to have the best quality of life possible. So we will rehabilitate them with physical therapists, and when they have cognitive issues, we will work with them with neurologists, and we have 11 different specialties. So we want he or she to have the best quality of life after cancer treatment.
Alejandra connects deeply with these families because she too faced the same uncertainty with her child. Pablo, her firstborn, was diagnosed with cancer at the age of 2, just as her and her husband began their lives in Boston.
I honestly cannot think of a worse news for a mother to receive than to hear that your son or your daughter has cancer. Not only to face the possible death of your child, but also that the only way of saving him is putting him through this extremely aggressive treatment, something that is long, that hurts, that is painful, that may leave secondary effects in him. So having to put him, in my case, him through this hurts. I don't recall how many times I would say, I wish it was me and not him. As a mother, to see a child go through this, it's so painful. We then have 2 more kids, and Pablo relapsed 3 times, so they went through that treatment. So we as a family feel like we went through cancer. Siblings, for them, it's very, very hard as well. They feel neglected. You as a mother need to make choices and choose to be with the sick one, and the others are left behind. And siblings, parents, we all survived cancer. Pablo was diagnosed, but we all went through this. It's a thing that really, really marks each of us for good, for life.
When her son was diagnosed, it just so happened that they were living someplace that had treatment available.
I feel so blessed and lucky that he could be treated here in the United States because there was a cure available here. And they did, they cured him. But that's not the reality in Latin America. So it hurts. It still hurts to think, what if? What if Pablo, or what if we could have not had the opportunity to treat him here? So that's my passion now, the cause. I think that I want every child in Latin America and in Chile to have the opportunities that Pablo had. Because as a mother, if there is treatment available somewhere in the world, you as a mother would do whatever it is to save or to protect her son or daughter. I'm working in this field with such a passion because I want that every child has the same opportunities as Pablo. And I want every mother whose child is diagnosed with cancer to feel the way I feel, that if there was a treatment available, my son had access to it.
The St. Jude Global Mission works to provide that kind of access around the world. Alejandra says there's much more work to be done in Latin America.
In Chile, our survival rate is 78%, so it's a very, very high survival rate compared to developed countries. But in some Latin American countries, like in Bolivia, it's up to 30%. So in Chile, we are receiving children from different Latin American countries. We host them because they travel to Chile to receive treatment. So we are not only providing services to Chilean kids, but also for other Latin American countries. So we are now expanding our coverage. We are building a new building because we want to improve our capacity and be able to receive children with cancer from different Latin American countries.
Reaching out beyond their borders to those who need help, the Foundation is part of a chain of collaboration and compassion to increase the possibility that every child has a fighting chance.
What keeps me up at night, or my big worry, would be that in the world, many children are dying because of cancer. And it strikes me to think that in some countries, survival rates are so high, and in some other countries are so low. Most of the kids who are dying from cancer are dying because of reasons that could have been prevented. When they're diagnosed, it's too late. Usually all palliative care is the only outcome possible. Kids are dying because of treatment abandonment. They have to travel from one city to another. Like in my country, they need to relocate to receive treatment, either to another city or to another country. As I said, children are moving from some other countries to Chile. But then there's a point when they cannot afford to live or to rent or to, so they abandon treatment. So kids are dying because of a treatment abandonment. Kids are dying in some country because of preventable reasons like infections. When their immune system is low, they get like this infection and they would just die. So all these deaths could be prevented, and there is treatment available. The scientific community is doing so much, and we as parents are so grateful for every person who came to the right protocol, and the right protocol that saved Pablo's life, for example. I know it came because of many scientists who've been researching and studying. But that treatment is not always accessible to every child. That's what really keeps me awake at night sometimes because, as St. Jude said, a cure for all. And that should mean everybody, all the children.
No child should die in the dawn of life are the words of Danny Thomas, the founder of St. Jude Children's Research Hospital. And those words are what guides the St. Jude Global Mission to work to ensure every child, no matter where they are born, has access to life-saving treatment.
we are all from so different cultures, but we are all facing similar challenges. And that's amazing. You talk to people from different continents, different regions. We all have the same purpose. We all want to, save more lives. We want to make children have the best quality of life. We want to cure kids, and we want them to have a full lives ahead of them. And that's exactly what I really love about this Global Alliance, to learn, to share, to, collaborate. We don't need to reinvent the wheel every time. Sometimes you're just talking to somebody who has just come to a similar challenge and developed something that is interesting, and you said, hey, we can adapt that. And what I really like about this is that if I was working in the corporate world, probably we'll be all competing, not really sharing, how it is a corporate. Here, everybody wants to help.
The St. Jude Global Alliance works to connect and to share knowledge worldwide to make it possible for every child to have a fighting chance, the kind of outcome Alejandra's son Pablo has. 20 years later, he's healthy and has no lasting side effects.
Pablo is studying. He has a girlfriend. They were backpacking last summer. He plays soccer. He climbs the hill. He's happy. He's a man. Now he's 24. He has a full life ahead of him. And that's something impossible to not be every single day of my life grateful for.
Alejandra's story had a happy ending, but unfortunately, it's not the ending many parents and patients in other countries experience. Survival rates around the world today are still 20% in many countries and with limited access to care. St. Jude Global, along with the World Health Organization, has partnered with hundreds of institutions around the world, committing to increase survival rates to 60% by the year 2030. Thank you for listening to our story. We hope you enjoyed learning more about our partners in the St. Jude Global Alliance. This episode was produced by Geoffrey Redick. It was edited by Grace Corzico Evans and Evelyn Skoda. Recorded by Jason Latshaw. And I'm Suheir Rasul.